At least 183 people have been killed in South Africa since January 2017, and almost 1,000 infected in the world's worst recorded listeria outbreak. Government has linked the outbreak to a meat product known as polony, a cheap form of protein consumed mostly by South Africans, made by Tiger's Enterprise Food. The disease causes flu-like symptoms, nausea, diarrhea, and infection of the bloodstream and brain. The disease is not a notifiable disease across Southern African countries, meaning doctors are not reporting each case to a centralized authority. Health Minister Aaron Motsoaledi has warned that there could still be other fatal cases.
You must understand that we are just at the beginning of fighting, a very big and complex problem here. So we must expect that other cases might still emerge. We've been detecting listeria almost every year. Every year in the country. But because it was not notifiable, we could know that the cases are rising.
The public has been urged to avoid ready-to-eat processed meat, especially polony. Authorities have also emphasized, though, that healthy people are not at risk of developing listeriosis.
Listeria targets people in certain vulnerable risk groups, and this includes pregnant women, very young infants, people over the age of 65, and anyone with a weak immune system. And importantly, in our population, this refers to people with HIV, with cancer, with kidney or liver disease, or with diabetes. So 40% of our cases overall have been in newborn babies. So this means that it's the pregnant mom that gets infected.
While in South Africa there have been 967 confirmed cases and 183 deaths from listeriosis, there has only been one patient in the rest of Southern Africa identified with the disease, despite many countries importing implicated products. Namibia recorded a patient on March 12.
Despite the listeria outbreak here, many neighboring countries say they still trust the South African product. They've agreed to go on a major education drive to ensure that this outbreak is at least contained for now. Yolisa Njamela for CGTN in Pretoria, South Africa.